Today we're going to be talking about this. This is called Raynauds phenomenon, and it is a perfect example of why everything in anatomy, physiology, and pathology is so messy and hard to understand. Because here we have two forms of this. We're going to talk about the primary one first. That is driven by the sympathetic nervous system and the actual muscle of the blood vessel in your arteries or arterioles, be down to the capillary level where we talked about everything gets really small, back in the circulatory system. And that is a normal response because when we get cold, our body constricts those blood vessels in our peripheral areas, which includes your fingers, your nose, your ears, your toes, and your nipples. So it constricts those to shunt blood to the core to keep us warm. So this is a perversion of a normal systemic response. Now, with primary, it can be triggered by stress also. So you see where this is getting messy. We can have a physical reaction to cold, or we can just get stressed out. Now, this is complicated if you use stimulants like caffeine, nicotine. Those can make us kind of hyperactive and kind of tune our sympathetic nervous system up. So that's actually one of the ways that you can treat this is by avoiding caffeine and nicotine, other stimulants, and things that constrict our blood vessels. Now, that's just primary. Primary is transient and generally more of an inconvenience than an actual danger. That is, I'm not trying to underpin it. It's still super annoying and can be really unpleasant. But the secondary form actually starts to involve an immune system component. So you might have things like immunoglobulin M and an allergy-esque response. And it is always accompanied by another, usually more severe condition like MS, Ehlers-Danlos syndrome, EDS, scleroderma, that kind of thing. And in these, when it's paired with these other conditions, it is generally, the Raynauds phenomenon is generally more severe. And when I say more severe, it can cause a clamping down of those blood vessels, constriction again, that you can't get to stop. And so it is depriving the tissue of oxygen, and this can cause tissue death. It can lead to gangrene, and in extreme presentations, you can actually lose the digits. Okay, so you can lose your fingers, your toes, ears, nose, and even your nips. And that's really unpleasant. Now, things that can treat this, there's medications like calcium channel blockers, stress management, so a mental component. Dietary things can be stuff like beet juice or other things that are high in nitric oxides, or if you want to go granola, something like ginkgo biloba. All right, so if you have questions, you know what to do. Thanks for joining the class.